Well, Shavana Taj is General Secretary of Wales TUC, and Tony Stein, CEO of Healthcare Management Solutions, who run a number of care homes across the UK and Wales, including Cardiff, Newport and Ebervale. Good morning to you both.
Good morning.
Shavana, let me come to you first of all. The TUC against this. Why?
Well, actually, we do believe, the TUC does believe that the fastest way out of this pandemic is to get everyone vaccinated as soon as possible. And we can all help and support our great NHS workers by getting the jab when it's our turn and by encouraging our friends and our families and colleagues to do the same. But we do also then say the government should make clear that making vaccination a condition of employment is definitely the wrong approach. It may be discriminatory. It could open up employers to legal and ethical challenges if they enact a no jab, no job policy as the economy reopens. And of course, it's really important to note that not everyone will be able to get vaccinated for a range of different reasons, including pregnant workers, some people with disabilities, people with particular health conditions. And then younger people, of course, are much further down the prioritisation list. So if only those who are, say, for example, over the age of 50 have been vaccinated at the time their employer recruits, having decided to introduce a no jab, no job policy, employers may even run into indirect discrimination claims too. So I think that, it's not, and it's not the way to persuade people in the first place to get the jab. Employers should instead encourage their, workers to get vaccinated and give workers paid time off for the appointment when they get that call. And public health bodies also have a responsibility here to make sure that they're providing clear information about the vaccination in the first place.
Shavana, thank you. Let's just bring Tony into this. Shavana makes many good points there. There's lots of ifs, there's lots of layers across this, depending in which sector you're working. Where do you stand on this, Tony?
Morning, Claire. Morning, everyone. It's really simple for me. I think giving people a vaccine, it does help, obviously, protect the NHS. It's not actually helping to protect those people that people come into contact with. So if you have a vaccine and you go into your workplace, you're protected. You're not protecting everybody else. You can still shed the virus. So I think mandating it is very difficult. It's a really difficult concept to me. We're keeping this under review at the moment, but our view is, yes, I think, like Shavana says, everybody should be encouraged to get the vaccine. I just don't think at this stage we would be saying to people, if you haven't been vaccinated, you can't be employed. I think that's a personal decision. I think if you want to be vaccinated, that's up to you. What I would do is, as Shavana says, encourage everybody to look to the right places for information about vaccination before they make a decision. So that's not social media. It's not Twitter or TikTok or YouTube. It's actually look to proper sources of information about how safe the vaccine is, make your own decision, and hopefully you'll make the right decision.
I mean, I guess a question for you, Tony, in your line of work, can you afford to hire someone who isn't vaccinated?
Yes, we can. I mean, the problem, the difficulty we have as an employer is I have a statutory duty to protect my workforce, to make them safe, or to make the workplace as safe as possible. It's much more difficult for me to keep somebody safe if they haven't been vaccinated. That's how I look at this. So then I have to look ahead to, what does that do to me as an employer? What risks does that give me? Am I going to be at risk at some point in the future of somebody saying, well, I think I contracted the coronavirus in your workplace, so it's your fault. It would be a lot easier for me if everybody was vaccinated. That's the simple fact. The reality is, though, should I be forcing people to have it? Not sure. I think if people aren't vaccinated, what I will say is that amongst our workforce, there's a very strong likelihood we'll be insisting on them wearing PPE all the time, being tested constantly. So when everybody else is free of having to wear the PPE because they've been vaccinated, those who haven't maybe are going to be asked to continue to wear PPE. And that's not particularly pleasant for them. And it's more expensive for us.
Yeah. And Shavana, that will really weigh into people's decisions, won't it? Whether this is legal or not.
Yeah, absolutely. Well, we've always said that the best way around this, I mean, even if you just look at the NHS, our biggest employer, and they have one of the riskiest workplace settings, and it's managing to handle this extremely smoothly on the basis of worker choice and not coming out with a no jab, no job, sort of statement. And I think that other employers can take a lesson from this. But also, as Tony mentions, it is extremely important that employers also understand that they can't now start slacking on coronavirus safety at work. And ministers must remind employers to make sure that their workplaces meet COVID-secure guidelines. And, we have seen too many workplace infection clusters, and now is not the time to drop our guard. Let's make sure that, we are, employers, are not seeing the vaccine as a substitute or an excuse for ignoring or adhering to wider workplace health and safety issues as well. We've done some polling on this issue, and we definitely believe that a no jab, no job framing is the wrong way to look at this at the moment.
And Shavana as well, we've had a listener get in touch this morning saying, any decision on this needs to be universal. I mean, the UK government, we know, looking into it. The Welsh government at the moment say, it's not on the table. I mean, lots of questions for both of you, really, crossing those borders. And Shavana, what if you live in Wales and you work in Bristol?
Well, I think this is something that does need to be considered through, I would say, a four-nation approach. The last thing that we want is for some confusion, particularly, as has been mentioned about, people being able to travel and some restrictions on that sort of basis. So it does need a bigger conversation. But as I say, I think that going back to making sure our workplaces are safe, that people have time off when they need it, paid time off at that, to be vaccinated, and that we encourage people to continue making sure that workplaces, individual risk assessments have been conducted, because at the moment our polling tells us that only 1 in 5 workers in Wales have been even consulted on COVID safety measures, and 1 in 4 younger and lower paid workers say that they wouldn't be comfortable raising their safety concerns at work for the fear of repercussions from employers. So you can see, I know the Welsh Government has sort of taken to tightening COVID regulations, but we need to see full and proactive enforcement of the rules to protect workers, and also an approach to vaccination in the right way as well. As far as healthcare workers are concerned, vaccination is always a part of a wider approach to health and safety and minimising risk in the workplace. And the vast majority of healthcare workers have the vaccine because of a duty of care to their patients, which includes taking reasonable precautions to protect them from communicable diseases.
There is an awful lot to discuss on this issue. Really appreciate both of you coming on and sharing your thoughts. Thank you very much. That's Shavana Taj, their General Secretary of Wales TUC. And it was Tony Stein as well, CEO of Healthcare Management Solutions.